Okay, so we're going to do Coban taping for PIP range of motion. Most of your PIP injuries, in fact, most of the finger injuries are usually small finger and ring finger, but for the purpose of the demonstration, we're going to do index finger just so it'll be easier to see. And so a lot of our clients who have a PIP contracture, they really don't have very good range of motion for flexion or extension. And so Indiana Protocols talks about this taping, which we do with Coban tape. So we're going to tape them around to bring them down into flexion, which will stretch the capsule and lateral bands and whatnot. But your clients, oftentimes, they can't get a good position like this. They can barely bend the tip. And so sometimes it's a little hard to get the tape started. You kind of have to lasso around here on the tip of the little finger, or the tip of the finger. You can go around.
Can't really see.
You see there?
Yeah.
Okay, so then you get it on good, and then you're going to try to pull down a bit, and imagine a person with a stiff finger. This is not very comfortable. We kind of call it the Coban tape torture. So you bring them down a few loops, and then you're going to leave them like this for 5 minutes. Hopefully they'll relax out during that time. And so after 5 minutes, then you're going to go again and try to bring them down further into flexion. Okay, and again, this is not a comfortable treatment. Some clients do eventually do it at home to themselves, but this is kind of a hard treatment to do to yourself. The skin will change and start getting red and purple. Ultimately, you would work up to 5-minute sessions, wrapping it and then waiting 5 minutes and then tighten it down again, and do 4 sets of 5 minutes for a total of 20 minutes. But you certainly wouldn't start out a client with 20 minutes. So after you've done however many sessions you're going to do, you do not want to just pull the tape off after you've had them like this. If you just release the tape quickly, like if you were to cut it, the rebound is pretty unpleasant, and so I try to unwrap it pretty carefully or get to a point where I can slip it off, but hold their finger pretty much in the position that you've gotten them to. Okay, and then you can sometimes you can have patients just kind of give them a little resistance to push back out. Okay, so push them back out. Okay, so this would be Coban taping. Usually a client with PIP contracture, probably a client who has about 30 or so degrees of extension lag, and also limited flexion for stretching the soft tissues back out.